Sarah Martinez wiped the sweat from her forehead as she walked through the hospital corridors at 3 in the morning. Her 12-hour shift was nowhere near finished, and the emergency room kept flooding with patients. As a registered nurse with 8 years of experience, she had seen everything from heart attacks to car accidents, but tonight felt especially overwhelming. The automatic doors burst open as paramedics rushed in with another patient. Sarah quickly grabbed her supplies and moved toward the stretcher. The man lying there was conscious but clearly in severe pain. His military uniform was torn and bloodstained, and she could see multiple wounds across his arms and torso. "What do we have?" Sarah asked the lead paramedic as they transferred the patient to the examination room. "Navy SEAL, injured in a training accident. Multiple lacerations, possible internal bleeding. He's been conscious the whole ride but refuses pain medication," the paramedic explained quickly. Sarah looked down at the patient. Despite his injuries, his eyes were alert and focused. She could tell he was fighting to stay conscious through sheer willpower. His name tag read Jackson M, and she noticed the various medals and patches on his uniform indicating he was highly decorated. "Hello, I'm Sarah, your nurse tonight. We're going to take good care of you," she said in her most reassuring voice while beginning to assess his injuries. Marcus Jackson looked up at her with tired eyes. The pain was incredible, but he had been through worse during his deployments overseas. What bothered him more than the physical pain was being stuck in a hospital when his team was probably worried sick about him. "I need to get back to base," he said through gritted teeth. "My team is waiting for me." Sarah carefully examined his wounds while setting up in 4-line. "Sir, you're not going anywhere tonight. These injuries need immediate attention, and you've lost quite a bit of blood." As she worked, other medical staff came and went from the room. Dr. Williams, the attending physician, was dealing with 3 other critical cases simultaneously. Sarah found herself essentially running point on Marcus's care, monitoring his vital signs, cleaning his wounds, and keeping him stable. "The doctor will be in shortly," she assured him while adjusting his 4-drip. "In the meantime, I need you to stay still and let me do my job." Marcus studied her face as she worked. She moved with confidence and skill, her hands steady despite the hectic pace around them. But he was frustrated with the whole situation. He was used to being in control, used to being the one helping others, not lying helplessly on a hospital bed. After about an hour, Dr. Williams finally made it to Marcus's room. He was a tall man in his 50s with graying hair and an air of authority that filled the room. Sarah briefed him quickly on Marcus's condition and the care she had provided. "Good work, Sarah. Keep monitoring him closely. We'll need to run some more tests, but it looks like you've got everything under control here," Dr. Williams said before hurrying off to his next patient. As the night wore on, Sarah continued caring for Marcus. She noticed he kept checking his watch and looking toward the door anxiously. His vital signs showed he was stable, but she could tell something else was bothering him beyond his physical injuries. "Is there someone you'd like me to call?" she asked while checking his bandages. "Family? Your unit? My commanding officer knows I'm here." "That's enough," Marcus replied curtly. Sarah sensed there was more to his story but didn't push. She had learned over the years that patients often needed time before they were ready to open up. Instead, she focused on making sure he was comfortable and his pain was managed. Around 4 in the morning, things in the emergency room finally started to calm down. Sarah was able to spend more time with Marcus, monitoring his progress and adjusting his care as needed. She noticed he had been watching her work throughout the night. "You've been doing this long?" Marcus asked, surprising himself with his curiosity about this nurse who seemed so competent. 8 years, Sarah replied while updating his chart. "Started right out of nursing school. Must be tough, dealing with all this every night," he said, gesturing weakly toward the busy corridor outside his room. Sarah smiled slightly. "Some nights are harder than others. But I love what I do. There's something special about being able to help people when they're at their most vulnerable." Marcus found himself impressed despite his initial assumptions. He had always respected medical professionals, but he had never really thought much about what nurses specifically did. Watching Sarah work throughout the night, he was beginning to realize how much skill and knowledge her job required. As dawn approached, Dr. Williams returned to check on Marcus's progress. Sarah had prepared a detailed report of his condition throughout the night, noting every change in his vital signs and response to treatment. "Excellent work, Sarah. His condition has stabilized significantly. We'll need to keep him for observation for at least another day, but it looks like he's going to make a full recovery," Dr. Williams announced. After the doctor left, Marcus looked up at Sarah with genuine gratitude. "Thank you for taking such good care of me tonight. I know you had other patients to worry about too." "It's what I do," Sarah replied simply, but Marcus could see the pride in her work reflected in her eyes. The morning shift was arriving, and Sarah began preparing to hand off Marcus's care to the day nurse. She was exhausted after her long shift, but seeing her patients stable and on the road to recovery always made the fatigue worth it. "The day shift will take good care of you," she told Marcus as she gathered her things. "Follow their instructions, get some rest, and you should be back with your team soon." As Sarah walked away, Marcus found himself thinking about her dedication and skill. She had stayed by his side all night, monitoring every aspect of his care with the precision of a military operation. For the first time, he was beginning to understand that nursing was far more complex and demanding than he had ever realized. Little did either of them know that their paths would cross again very soon, under circumstances that would challenge everything they thought they knew about each other. 3 weeks later, Sarah was grabbing coffee at her favorite cafe near the hospital when she spotted a familiar face across the room. Marcus Jackson sat at a corner table, looking much healthier than when she had last seen him. He was in civilian clothes now, talking with 2 other men who appeared to be fellow service members based on their posture and short haircuts. Sarah hesitated for a moment, wondering if she should approach him. She had thought about him several times since that night, curious about his recovery and hoping he had made it back to his team safely. Finally, she decided to say hello. As she approached their table, she could hear fragments of their conversation. Marcus was telling his friends about his hospital experience, and what she heard stopped her in her tracks. "The whole place was chaos that night," Marcus was saying. "Doctors running around everywhere, barely had time to look at me properly. Ended up being taken care of by some nurse most of the night." One of his friends, a stocky man with a crew cut, laughed. "Nurses, man. They're okay for basic stuff, but when you really need medical care, you want a real doctor." Marcus nodded in agreement. "Exactly. I mean, she was nice enough, but it's not like she could actually do anything important. Just basic nursing stuff, checking vitals, changing bandages. Any idiot could do that job if they had to." The third man, tall with a beard, chimed in. "My sister-in-law is a nurse. Nice girl, but let's be honest, it's not exactly rocket science. Take some classes, learn to follow orders, and boom, you're a nurse. Not like being a doctor where you need real brains and education." Sarah felt her cheeks burn with anger and humiliation. She stood frozen for a moment, unable to believe what she was hearing. The man she had worked so hard to save, who she had monitored all night long, was dismissing everything she had done as meaningless. Marcus continued, apparently on a roll now. "Don't get me wrong, nurses are necessary, I guess. Someone has to do the grunt work while the real medical professionals handle the important stuff. But let's not pretend it's anything more than it is." "Right," his bearded friend agreed. "They're basically glorified assistants. Follow the doctor's orders, keep patients comfortable. Nothing that requires real skill or intelligence." Sarah had heard enough. Her hands were shaking as she turned around and walked quickly toward the exit. She couldn't believe she had actually worried about his recovery, had thought about him with genuine concern. The man she had fought to keep stable throughout that long, difficult night had just reduced her profession to basic nursing stuff that any idiot could do. She made it to her car before the tears started. 8 years of education and training, countless lives saved, families comforted during the worst moments of their lives, and this was how people saw her profession. As she sat in her car, Sarah thought about all the things Marcus didn't know about that night. He didn't know that she had caught the early signs of internal bleeding that the busy emergency room doctors had missed in their initial assessment. He didn't know that her quick intervention with medication adjustments had prevented his blood pressure from dropping to dangerous levels. He didn't know that she had recognized the symptoms of a potential blood clot forming and had acted immediately to prevent a life-threatening pulmonary embolism. Marcus had no idea that while he lay there complaining about wanting to return to his base, Sarah had essentially saved his life 3 different times throughout that night. The doctors were skilled and knowledgeable, but they were spread thin across multiple critical cases. Sarah had been his constant guardian, using years of specialized training and experience to keep him alive. As she drove home, Sarah's anger began to mix with sadness. She loved being a nurse, loved the challenge and the opportunity to make a real difference in people's lives. But comments like Marcus's reminded her of how undervalued her profession often was, even by the very people whose lives nurses saved every day. That afternoon, Sarah was back at the hospital for another shift. She tried to push the cafe incident out of her mind and focus on her patients, but the words kept echoing in her head. Any idiot could do that job. Her first patient was Mrs. Chen, an elderly woman recovering from major surgery. Sarah noticed immediately that something was off with her condition. Her breathing was slightly labored, and her color wasn't quite right. The monitors showed normal readings, but Sarah's experienced eye caught subtle signs that others might miss. She quickly assessed Mrs. Chen more thoroughly and discovered early signs of pneumonia developing. Her immediate intervention and coordination with the medical team prevented what could have been a serious complication. As Sarah worked, she thought bitterly about Marcus's words. Any idiot could do this job, apparently. Later that evening, Sarah was called to assist with a trauma case. A motorcycle accident victim had just arrived, and the emergency room was once again in chaos. The patient was unconscious and bleeding heavily from multiple wounds. As Sarah worked alongside the medical team, her training kicked in automatically. She anticipated the doctor's needs before they were voiced, managed multiple 4 lines simultaneously, and monitored the patient's vital signs with the precision that comes only from years of experience. When the patient's blood pressure suddenly spiked, indicating possible brain swelling, Sarah was the first to notice and alert the team. The trauma surgeon, Dr. Peterson, had worked with Sarah many times before. As they stabilized the patient, he looked over at her with respect and gratitude clearly visible in his eyes. "Outstanding work as always, Sarah. Your assessment skills probably saved this kid's life tonight," he said quietly as they wheeled the patient up to surgery. Sarah appreciated the recognition from Dr. Peterson, but it also highlighted the ignorance of people like Marcus. The public often saw only the surface of what nurses did, the bedside manner, the basic care tasks. They never saw the split-second medical decisions, the life-saving assessments, the complex clinical reasoning that separated trained nurses from any idiot. As her shift ended, Sarah found herself thinking about Marcus again. Part of her wanted to forget the whole thing, to write him off as just another ignorant person who didn't understand her profession. But another part of her felt angry enough to want him to know exactly what he had dismissed so carelessly. She remembered his name and his unit from his medical records. It wouldn't be hard to find out where he was stationed. Sarah wasn't normally a confrontational person, but something about his casual dismissal of her life's work had struck a nerve deep enough that she couldn't just let it go. The next day was Sarah's day off, and she found herself driving toward the naval base where Marcus was stationed. She wasn't entirely sure what she planned to say to him, but she knew she couldn't live with herself if she didn't at least try to educate him about what had really happened that night in the hospital. As she approached the base gates, Sarah began to second-guess her decision. What was she hoping to accomplish? Marcus clearly had his mind made up about nurses, and one conversation probably wasn't going to change years of ingrained prejudice. But then, she thought about Mrs. Chen, about the motorcycle accident victim, about all the patients whose lives had been saved by the quick thinking and specialized knowledge of nurses like herself. She thought about her colleagues who worked just as hard as she did, who saved just as many lives, and who deserved better than to be dismissed as glorified assistants. Sarah parked her car and walked toward the visitor's entrance, her heart pounding with nervousness and determination. She had no idea that her decision to confront Marcus would lead to a series of events that would change both of their lives forever. Sometimes the most important conversations are the ones we're most afraid to have. The security guard at the naval base was surprisingly helpful when Sarah explained she needed to speak with Marcus Jackson about a medical matter. After making a phone call, he directed her to wait in a small visitors area while someone located Marcus. 20 minutes later, Marcus walked into the waiting room, clearly surprised to see his former nurse sitting there. He looked completely recovered from his injuries, back to the confident, imposing figure she remembered from that first night, minus the blood and pain. "Sarah? What are you doing here?" he asked, genuine confusion in his voice. Sarah stood up, her heart racing. Now that she was face to face with him, she wasn't sure how to begin. "I need to talk to you about something. Do you have a few minutes?" Marcus glanced around the visitors area, which had several other people waiting nearby. "Sure, but maybe we could go somewhere more private? There's a cafe on base where we can talk." As they walked across the base, Sarah tried to organize her thoughts. She had rehearsed various versions of this conversation during the drive over, but now everything she had planned to say seemed inadequate. The base cafe was quiet in the mid-afternoon, with only a few service members grabbing coffee between duties. Marcus led them to a corner table away from the other customers. "So what's this about?" Marcus asked as they sat down. "Is everything okay? Did something happen with my medical records or something?" Sarah took a deep breath. "I overheard you yesterday at the coffee shop near the hospital. You were talking to your friends about your experience that night you were injured." Marcus looked confused for a moment, then, a flicker of recognition crossed his face. "Oh. You were there? I was getting coffee and I saw you. I thought about coming over to say hello, to see how you were doing." Sarah paused, trying to keep her voice steady. "But, then, I heard what you said about nurses." "About me." The color drained slightly from Marcus's face as he realized what this was about. He remembered the conversation with his teammates, remembered making dismissive comments about his hospital experience. At the time, it had just been casual conversation, the kind of thing guys said when they were talking tough. "Sarah, He began, but she held up her hand. "Let me finish, please. You said that any idiot could do my job. That nurses just follow orders and do basic stuff while the real medical professionals handle the important work." Sarah's voice was calm, but Marcus could see the hurt and anger in her eyes. "You have no idea what really happened that night you were in the hospital," Sarah continued. "You were too injured and in too much pain to understand what was actually going on around you." Marcus started to speak again, but Sarah wasn't finished. "When you came in that night, you had multiple lacerations, possible internal bleeding, and you were going into shock from blood loss. Dr. Williams was handling 3 other critical cases, so I was essentially managing your care for most of the night." Sarah's voice grew stronger as she continued. "About 2 hours after you arrived, I noticed your blood pressure starting to drop and your heart rate increasing in a pattern that indicated internal bleeding the initial assessment had missed. I immediately started a second 4-line and began fluid replacement therapy while calling for Dr. Williams." Marcus sat quietly, beginning to realize this conversation was going to be very different from what he had expected. "Around 3 a.m., I caught the early signs of a blood clot forming in your leg. The symptoms were subtle, slight swelling, minor temperature difference, a change in your pulse pattern that most people wouldn't notice. If that clot had broken loose and traveled to your lungs, you would have died." Sarah leaned forward slightly, her eyes locked on Marcus's. "I administered anticoagulant medication and repositioned you to improve circulation. Then, I monitored you every 15 minutes for the rest of the night to make sure the clot was dissolving properly. The most critical moment came around 5 a.m., Sarah continued. Your oxygen saturation levels started dropping, and I recognized the signs of fluid building up in your lungs. This was a complication from your injuries that could have led to respiratory failure. I adjusted your 4 medications, elevated your position, and administered breathing treatments that prevented what could have been a life-threatening situation." Marcus was staring at her now, his mouth slightly open. He had no memory of most of these incidents. He had been conscious but heavily medicated and focused mainly on his pain and frustration at being hospitalized. Throughout that entire night, Sarah said, her voice quieter now but still intense, I was making complex medical decisions that required years of education and training. I assessed your condition continuously, anticipated complications before they became critical, and coordinated your care with multiple departments. She pulled out her phone and showed him something on the screen. This is my nursing degree from Johns Hopkins. 4 years of pre-nursing courses, then a 4-year Bachelor of Science in Nursing program. After that, I spent 2 years in specialized emergency trauma training. Marcus looked at the phone screen, then back at Sarah's face. I hold certifications in Advanced Cardiac Life Support, Pediatric Advanced Life Support, Trauma Nursing Core Course, and Critical Care Nursing. I'm required to complete 40 hours of continuing education every 2 years just to maintain my license. Sarah put her phone away and leaned back in her chair. So when you say that any idiot could do my job, you're talking about someone who has more medical education than most people will get in their entire lives. When you say I just follow orders and do basic stuff, you're dismissing the fact that I saved your life at least 3 times that night. The cafe around them seemed to fade away as Marcus processed what he was hearing. He thought back to that night in the hospital, trying to remember details through the haze of pain and medication. He had vague memories of Sarah constantly checking on him, adjusting things, asking him questions, but he had assumed it was all routine nursing care. I had no idea, Marcus said finally, his voice barely above a whisper. Most people don't, Sarah replied. They see nurses giving medications and think we're just following orders. They don't realize that we're the ones calculating dosages based on patient weight, kidney function, and drug interactions. They see us checking vital signs and think it's busy work. They don't understand that we're watching for patterns and changes that indicate life-threatening complications. Marcus was quiet for a long moment, staring down at his hands. When he looked up, Sarah could see something had changed in his expression. I owe you my life, he said simply. You don't owe me anything, Sarah replied. I was doing my job. But you do owe it to yourself and to other people to understand what that job actually involves before you dismiss it. Marcus nodded slowly. You're right. I was completely wrong, and I'm sorry. Not just for what I said yesterday, but for thinking that way in the first place. They sat in comfortable silence for a few minutes. Finally, Marcus spoke again. Can I ask you something? Why did you come here today? You could have just written me off as an ignorant jerk and moved on with your life. Sarah considered the question. Because I've heard those same comments too many times from too many people. And usually I just let it go. But something about hearing it from you, someone whose life I had fought so hard to save, just really got to me. I'm glad you came, Marcus said. I needed to hear this. My whole team needs to hear this. Over the next hour, Sarah found herself telling Marcus about her work, about the challenges and rewards of being a nurse, about the complex medical knowledge required for her job. Marcus listened intently, asking thoughtful questions and sharing his own experiences as a SEAL, drawing parallels between the life-or-death decisions they both made in their respective fields. As their conversation wound down, Marcus looked directly at Sarah. I want to make this right somehow. What I said was not only wrong, it was disrespectful to you and to everyone in your profession. Just remember this conversation, Sarah said as she gathered her things to leave. And maybe next time you hear someone dismissing nurses, you can share what you learned today. Marcus stood up as she prepared to leave. Sarah, would it be okay if I stayed in touch? I'd like to learn more about what you do. And I think there are some people on my team who could benefit from hearing your perspective. Sarah smiled genuinely for the first time since entering the cafe. I'd like that. As she drove away from the naval base, Sarah felt a sense of satisfaction she hadn't expected. She had come here angry and frustrated, ready for a confrontation. Instead, she had found someone willing to listen, to learn, and to change his perspective. 3 months later, Sarah received an invitation to speak at a military medical training seminar. The invitation came from Marcus, who had arranged for her to present to military personnel about the role of civilian emergency medical staff in treating injured service members. Standing in front of an audience of soldiers, sailors, and Marines, Sarah shared her expertise and experience with confidence and pride. In the front row, Marcus listened intently, taking notes and nodding in appreciation. After her presentation, a young sailor approached her with questions about pursuing a nursing career after his military service. As Sarah answered his questions, she caught Marcus's eye across the room. He gave her a thumbs up and a smile that conveyed more respect and gratitude than words ever could. Sometimes the most important victories aren't won on battlefields or in hospitals, but in quiet conversations where minds are changed and respect is earned. Sarah had fought for more than just recognition of her profession that day. She had fought for the dignity and value of caring for others, no matter what form that care takes. And sometimes, the best apology isn't just words, but action, the kind of action that ensures others won't make the same mistake twice.